Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a problem of middle age when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Swati Agarwal is a well-known dermatologist and has been practicing medicine for over 20 years now. She's MBBS MD specializes in dermatology, cosmetology and trichology. Currently she's practicing in her own clinic, Skination, Chhatarpur, South Delhi and also in Faridabad. Dr. Agarwal has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized hair care services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Agarwal is also aware of the need for the patient education and hence spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer on few questions for us today. Welcome to this YouTube live show.
Thank you, Dr. Mona. It is such a pleasure to be here and thank you for the introduction.
And Dr. हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया and today we are going to talk about hair care in current scenario. So whenever we talk about hair care in current scenario, the very common problem which is faced by all of us irrespective of gender and age is like hair loss. So can you please enlighten us today with your profound experience, like what's normal and when to be concerned for?
Right, absolutely. So that's the first thing that comes in hair loss, Dr. Mona. So when we talk about the strands, the number of strands that should fall and should be considered normal. If you talk about the exact number, it is around 100 strands daily, which sounds as a big number. Patients come and say 100 is too much. I will go bald with 100 hairs falling daily. But we
Mhm.
have to understand there is something called as hair shedding, which is natural, which is normal. And in medical terminology, we call it physiological. That is something, some hair loss is bound to happen. And we have
Mhm.
to consider it as physiological, part of our daily routine. So if
Mhm.
we consider that, then 100 hairs shedding daily is absolutely normal. Although,
Mhm.
if the
Mhm.
hairs are not growing back, that you will understand if you think that the density is less, my pony is getting thinner, I'm seeing bald area like genetic hair loss in men, or
Mhm.
overall you see thinning of hairs, then absolutely the number does not matter. Even less hair falls than 100 hair fall daily. If with such pattern loss or overall thinning or loss of density, then it is alarming. Otherwise, 100 hairs falling and then new growth coming, there is no loss of, overall density in the hair or thinning or pattern loss, then this should be
Mhm.
considered as absolutely normal.
Okay, so like more than 100 hair and hair is everywhere and people are complaining like तुम्हारे बाल हर जगह है. So that means doctor को चले जाना
Yes,
चाहिए instead of waiting.
yes, yes.
Okay, interesting, doctor. So now doctor जब अब we know that like okay this is the alarm sign. तो दूसरा question ये होता है जो लोगों जिन लोगों को hair loss होता है वो देख के पास के यार मेरे साथ ही ऐसा क्यों हो रहा है. So what are those general causes of hair loss?
General causes of hair loss. See, first thing we have to understand here is about when we discuss the causes of hair loss is that hair is very sensitive to various things that happens to us because
Mm-hmm.
they are very fast growing cells. The way we understand, we say that a child in growing age needs nutrition, needs care, needs everything because he's in the growing age.
Mm-hmm.
Similarly, hairs are always in the growing age in the sense they are very fast dividing cells. That's how the length of the hairs increase. We always have to trim and stuff because they are fast dividing cells. So, for any such part of the body or any such cells that are always proliferating or there's some activity happening, they are
Mm-hmm.
sensitive to many, many things, right?
Mm-hmm.
Therefore, various things can result in hair fall because they can sense so many things. Now,
Mm-hmm.
enumerating what all can result in hair fall. For
Mm-hmm.
example, number one, nutritional deficiencies. If we are not eating well, can be
Mm-hmm.
for various reasons. Sometimes we don't know what balanced diet is. Sometimes
Mm-hmm.
even a gym person eating a lot of proteins or they are on a particular type of diet, only keto diet, only diabetic diet, only low carb diet. So that means your
Mm-hmm.
diet is not nutritive enough. It is not balanced.
Right.
Many times, for example, Indian females are deficient in iron. They have low hemoglobin. So nutrition content, the oxygen that is carried in the blood to various parts of the body is deficient. As a result of that, you always are on the deficient side. So first and foremost for me, especially for the Indian people, especially
Mm,
Indian females, will be nutritional deficiency.
mm,
Then the other cause is, for example, genetics. Now, genetics
mm,
is something you can't modify, and this
mm,
plays a greater role in male pattern loss.
yeah.
We see bald area on the front, and men developing baldness on the frontal part, and then progresses to vertex, which is more of genetic hair loss.
Mm,
Nowadays, the age of genetic hair loss has become much earlier. Then comes the role why the age of onset has become much earlier. Then
mm,
comes the third cause, which is lifestyle. We say we are
mm,
not eating well, we are not giving enough exercise to our body, we are not resting well, we are not in mental peace. So all these things that have changed over the time, all of us are into some or the other stress. So here comes the third thing, that is the lifestyle, the stress causes. Because again, the fast dividing cells, if you're in a lot of stress, there comes something called as telogen effluvium, which is a very,
mm,
very common type of hair loss, where after some particular type of stress, which can be
mm,
physical or mental or emotional,
mm,
or some accident, even students having exam, female giving birth to the child where the body is under stress,
mm,
can result in hair loss. So fourth comes stress. Then various infections, when you're not well, a patient develops high grade fever or malaria or typhoid or needs hospitalization, can result in hair fall.
mm,
Also, smoking is a very, very common cause because your body gets into oxidative stress. Then
mm,
comes other chronic diseases, for example, diabetes. Then, when there is hormonal changes, for example, undiagnosed thyroid not treated, hypothyroidism is a cause of hair loss. Then,
mm,
when you get into menopause, a female getting into menopause is a change of the hormones in the body. Then, again, a
mm,
cause of hair loss. Then, aging, because as we age, the hair start to get thinner, the body, the blood circulation starts to decrease. So,
mm,
another cause. Then, exposure to chemicals, a lot of
mm,
saloon services. This point should not be missed, that saloon services and a lot of chemicals put. Obviously, the shafts get thinned out, the chemicals
mm,
applied actually damage it. So, those are
mm.
also the causes of hair fall.
Okay,
So,
that's
these
interesting.
are the common ones. Yeah.
Yeah. So it was very informative, doctor. So, doctor, you said that diet is very important, and also like females don't pay attention to the diet. So there is one more thing is like these days and this era is like quite busy, and we don't sleep on time, we work like late night, and we don't pay attention to what we are eating, and ready to uh, ready to cook meals we are eating, and we are eating outside. So can a person's lifestyle like in whole play a role in hair loss?
Absolutely. A lot and lot is actually affected by a poor lifestyle. Because,
Mm,
see, we have to understand a chronic bad lifestyle will actually take a toll on the health also. For example, if even diabetes in young age, hypertension is young age, are lifestyle diseases. When you're not eating
mm,
well, when your diet is not proper, when you're stressed out, when you're not taking rest, you can develop diabetes and hypertension. Those are the known causes and precursors of these lifestyle diseases. Also, when, as you mentioned, the ready to cook meals, they are deficient in the nutrition, they are deficient in minerals, in vitamins, in the recommended daily allowances of various micronutrients are not there in them. And then
mm,
also, not only that, the ready to cook food, many a times you are food fat, you eat this, you don't eat that, you like this, you don't like that.
mm,
So those things also are a very, very common cause of hair loss, because nutrition is on a toll. Your body is not getting the right type of food, and therefore the hairs are not going well.
mm. Okay, that's interesting. So doctor, now that we know like what is like what are the causes, and even the lifestyle is important, another very common questions in this era of information where information is flowing like anything, even जब हम travel करते तो there will be like posters like 1,000 rupees में सारे बाल आ जाएंगे. So people are quite actually misinformed about the treatment. So can you please enlighten us today with this platform, like what are the medical treatment options actually available for hair loss, like tropical, non-tropical, or surgical, or any other?
So see, there are various options. Yes,
Mm,
as you enumerated, there are topical options, there are oral, there are surgical options.
mm,
So this basically depends on patient's profile. For example, a female patient coming with hair loss, first thing that we always do is to know the nutritional status. What is she
mm,
eating? What is her diet plan? And there
mm,
then also come some investigations to know if she has low hemoglobin, if the
mm,
iron reserves are okay or not. Is she a
mm,
hypothyroid patient? Are the hormones disturbed? Are the cycles disturbed?
mm,
uh, is she taking folic acid supplements? Is she, just out of her pregnancy, just in the postpartum phase? So
mm,
various things actually that we need to know for a patient. So various options in that case, for example, nutritional supplements.
mm,
Nutritional supplements also play a role in male pattern loss, not only for
mm,
female pattern loss.
mm,
And for example, Indians who are vegetarians are many times deficient in vitamin B12, right?
mm,
Vitamin D, many patients have deficiency of vitamin D. So these supplements help in hair loss when you basically give these supplements. Also,
mm,
iron deficiency, moment you supplement them for iron, folic acid, the hair starts to grow better because that was the deficiency. So various type of phytoceuticals and nutraceuticals are one of the oral treatment. Then the oral treatment also can be hormonal treatment. For example, if it's a hormonal loss, so if you know finasteride medicines come, they are mostly given in male pattern loss, androgenetic alopecia, and also in female pattern hair loss when it is a post like menopausal female. Then even nowadays oral minoxidil is available, which is otherwise a antihypertensive drug, but when it is given, it increases the scalp blood flow and increases the hair growth. So that means there are various supplements, then hormones, then minoxidil, which can be given orally. Coming to topical, there are again various types of formulations. First and foremost, which is an approved one, is minoxidil, because again, minoxidil works by increasing the blood flow in the scalp skin. So when you apply minoxidil, the overall, the scalp circulation, the blood circulation in the scalp increases, and as a result of that, the hair start to grow better.
yeah.
Similarly, there are various phytochemicals. There is Procapil, Capexil, Redensil. We all know that these are other, and there are other phytochemicals. For example, if you know, there's a caffeine-based solutions. There are various plant extracts when applied on the skin can either boost the collagen in the hair root, or it can boost the growth factors, and therefore it can work by topical application. Then comes, various procedures, as you were asking. There comes the role of platelet rich plasma, growth factor concentrates. If you know, there's something called as regeneractiva. There are three four other type of procedures. They make use, for example, PRP and GFC make use of your own blood, from which the platelet rich plasma or growth factor concentrate is extracted. These are the growth cells or the growth concentrates in both of these, like PRP and GFC, and they are put back in the scalp skin so that they reach the root and enhance growth. In Regeneractiva, what you do is that you take the follicle, basically the root of the follicle from the occiput part. Like for hair transplant, you take 2,000, 3,000, 4,000. Regeneractiva, you take only three of the follicles from the back of the head, and you basically process them in kits, and there are various steps to it, and then you inject it in the scalp skin so as to give the stem cells for growth. So these are some of the procedures. Then comes your surgical modality, as we know, is just hair transplant. That
Yeah.
depends. That's mostly for patients who have developed patterned growth. For example, the front is lost. They want to design their hairline. The hairs are looking sparse in the front. The vertex is lost. In many
Yeah.
of such cases where the disease has progressed to stage 3, 4, where already the scalp skin is visible, the procedures are not giving much of the result, then the candidate is a perfect candidate for hair transplantation, where we extract, basically take the follicles from the occiput, and we basically put it on the frontal part where we want to, do the hair transplant. And that's one of the surgical modality with which hairs can be restored.
Okay, that's very informative and very interesting, doctor. Like there are many options available. People don't need to feel not confident and sitting at home and not going out. Instead of that, they can go to the doctor and get the treatment done and get their confidence back.
Absolutely,
Okay. Yeah.
absolutely.
So, doctor, like you said a word called nutraceuticals, and most of the people are like on Instagram everywhere. There is informations about them. nutraceutical. So most of the us actually don't know what is this nutraceutical and what does role it play in hair health.
So basically, see, nutraceuticals, as the name suggests, nutrition in the form of,
Mhm.
the mixture of it. So
Mhm.
basically, as I was saying, there are various nutrient, like minerals, vitamins, and even micronutrients that we lack in our diet many a times because we don't
Mhm.
even know what to eat, what not to eat, and what we need for better hair growth. Here comes
Mhm.
the role of nutraceuticals, where the various vitamins and minerals are actually being put together and you
Mhm.
consume that so as to get better
Mhm.
hair growth. For example, uh, deficiency, as I was saying, of various B complex vitamins. For example, vitamin
Mhm.
B12, vitamin B2, B3, B7, various B complex vitamins, we call them, can result in hair fall. Also, even
Mhm.
vitamin C deficiency. People many times don't like citrus food. They avoid anything which is a little sour, so they don't consume the citrus
Mhm.
fruit. So vitamin C deficiency can result in hair loss. Then comes the role of vitamin D. People only know vitamin D about bone health. The weak
Mhm.
bones are because of deficiency of vitamin D. They hardly know that vitamin D deficiency can result in hair fall also. So
Yeah.
nutraceuticals have that also. Then comes vitamin A, vitamin E. Then comes the role of zinc, selenium, magnesium, those micronutrients. So nutraceuticals put together in the recommended doses these vitamins so that, these micronutrients, so that when you consume them, you get the best of the outcome. The only catch here that you have, why you need to know and discuss this with your doctor, is you should take the right doses for the right
Mhm.
durations. We have to understand even the overdose can result in hair fall. Many times
Oh.
people are blindly consuming vitamin E because somebody told them
Mhm.
vitamin E will result in better growth. So they keep consuming
Mhm.
it. So overdose of
Mhm.
vitamin A, vitamin E can again increase hair fall. So, knowing the safety, the efficacy, the recommended doses, the durations, like
Mhm.
which one would be better for them. For example, people many times keep taking biotin with not a lot of
Mhm.
result because we are hardly deficient in biotin.
Mhm.
So, basically, that's why they don't get the desired result. So, it's always important to know the ingredients, to take from
Mhm.
reputed brands. Doctor's
Yeah.
recommendation plays a role. Yeah,
Mhm.
that's how nutraceuticals should be,
Okay,
taken into account.
it's very eye-opening, doctor. So like people buy it and keep popping the pill. So does it really, like, even the gender play a role? Whether is there any RDA requirement as per the gender guidelines, and we should take it in the supervision of doctor, and we should not like take it blindly? What do you
Mm. See,
suggest?
to be honest, nutraceutical industry is not very guided because you don't need a lot of FDA approvals to get into
Mm-hmm.
the nutraceutical market. Therefore, they are very rampantly available. Many a times when I see, I realize that the doses are not appropriate. Recommended doses somewhere sometimes are not mentioned. So yes, absolutely. If you're giving it to a teenager, when you're giving it to a female, to a male, or what lifestyle they have, and why is the hair loss? If it is a male pattern hair loss, or a female having hair loss, or if it is telogen effluvium, or if the investigations say that yes, there is an iron deficiency. So, depending on that, the recommended allowances are different, and therefore it absolutely has to be taken into account.
Okay. Okay. It's very interesting, doctor. So, doctor, now that we have talked about hair loss and we talked about everything like treatments and other part, another very common problem which is faced by all of us is the dandruff. So, can you please enlighten us, like, what is this dandruff is actually, and how does it play? Does it play any role in hair fall or hair loss?
Yes. So, see, yes, dandruff can definitely result in hair loss because we have to understand some dandruff people have because of change of weather and something like that for a short while might not affect hair fall to a great extent. But definitely chronic dandruff, because it's not only the fungal growth, it is also inflammation on the scalp skin. Then it can definitely result in hair fall. And we must definitely work on, making the dandruff, or what we call as seborrheic dermatitis, the severe form of dandruff, better, because obviously if it is treated, the hair follicles also get a more healthy environment to grow. And with the dandruff, there's itching, we scratch, we rub, then obviously the chances of fall, the chances of irritation, the trauma also increases. So that is also a cause of hair fall. So surely dandruff can actually, any such inflammatory condition of the scalp in that scenario can result in hair fall. So why not dandruff, which is one of the most common cause of concern when it comes to inflammatory conditions of scalp. So it can also result in hair fall for sure.
Okay. Very interesting, doctor. So, doctor, we talked about lifestyle and we talked about nutrition. One very common fact in lifestyle is the stress, which is like unavoidable. So, does stress have any impact on hair health?
Absolutely. Telogen effluvium, for example, the one term that I was mentioning in the start of the talk, talks about, hairs getting affected by stress, which can be a physical stress when you're not well, when you have fever, or when you're hospitalized, or when you have an accident, or anything that took a toll on physical health is a stress. Then mentally, when you are stressed out, your mind is not in the perfect shape. It can be a chronic stress, or even an acute stress, which is more than what you can manage. Then it can be an emotional stress, or various types of stress result in oxidative damage to our body, our skin, and our hairs, and is a very common cause of hair loss. It is interesting to know, Mona, here that many a times you have some acute stress and the hair falls after around 3 to 4 months, because hairs enter into the telogen phase, which lasts for around 3 to 4 months, and then your hair falls. So when you ask your patients, when you talk to them, and when you ask, were you in stress? Were you not well? Were you into a bad state physically, mentally, emotionally? So they date it back around 3, 4 months back, and they say, doctor, that is an old story. That was 3, 4 months back. Now I'm okay. And sometimes fail to understand that this hair fall is happening because of the stress that is dated like 3 to 4 months back. But because the hair goes into the fall phase, which is the telogen phase, stays there for around 100 days roughly. There is no fixed duration, but roughly 100 days, like say 90 to 120 days. And then it falls. So stress can definitely be a cause. Only temporally correlating it with stress might be a little tough. And that is where the doctor can help you.
Okay. Okay, so that means both physical and mental stress, we need to manage it instead of just thinking कि अच्छा infection हुआ था इसलिए hair loss हो रहा है. But even mentally we should be strong and manage our stress so that all those hair fall or any other lifestyle disorder we can protect ourselves. Okay, that's interesting, doctor. So doctor,
Yes,
जब
yes,
हम
absolutely, absolutely.
सो डॉक्टर वेन जब ये हम स्ट्रेस की बात करते हैं तो एक घर का नुस्खा जो हर ग्रैंड मदर देती है इज लाइक कि ऑयल लगा लो एंड मसाज कर लो एंड ऑल्सो दे से कि भर के लगाओगे द मोर यू पुट ऑयल द मोर स्ट्रॉन्गर एंड थिकर योर हेयर विल बी एंड योर हेयर विल ग्रो ऑल्सो सो व्हाट डू यू थिंक लाइक ऑयलिंग हेयर इज गुड और बैड
So this session would have been incomplete without discussing the oiling of the hairs, I'm sure, because almost 100% of the patients ask that. So good that you have brought this question. See, we have to understand some facts about hair oiling. Hair oil is like a conditioner. The way you put moisturizer on your body, you're putting some conditioning on the hairs. So where do you need the conditioning is on the shafts. So first thing to be noted is that you need oiling on the shafts, not on the scalp skin. People do opposite. They massage their scalp skin. We all have been doing that actually. I am, and you are no exception. Everybody, they massage their scalp skin thinking that would enhance growth, and they leave the shafts, or even if they do the shafts, they do on the roots. So there's no extra benefit of doing a lot of chumpy, what we call it, on the scalp skin. Because yes, when you massage, there's a little increase in the blood flow. You feel better. It is a little de-stress that happens, because massage in itself is a de-stress mechanism. But that's
yeah
it. Because you're putting a lot of hair oil on the scalp skin, obviously you'll need more shampoo also to wash it off. You would need a lot of, massaging of the shampoo to get the hair off your scalp skin. So hair oil, the main purpose is conditioning, and therefore what where you need it is on the shafts. Okay. Also, putting the hair for long hours, say 1 day, 2 day, or overnight is not needed, because you are conditioning it. Even in 1 hour or a couple of hours, the conditioning effect happens. So just 2 hours before your head wash is planned, like a couple of hours before that, is more than enough.
Mm-hmm.
There's something very interesting nowadays. The entire Insta, I'm sure everybody sees the rosemary oil thing that they say that it works so well. So yes, that also is known to increase a little circulation in the scalp skin because of the massage and the effect. But that's too
Mm-hmm.
minimal to help in the hair loss. So,
Okay.
and also the data is very less. It's not that you use rosemary oil and you get a lot of change. Minoxidil
Mm-hmm.
stands far superior because it is much more tested, researched. It is
Mm-hmm.
available after a lot of stringent testing that has happened. So,
Mm-hmm.
relying totally on hair oil for hair growth might not be a good idea. It's actually not a good
Mm-hmm.
idea.
Mm-hmm. Okay, okay, that's very interesting. Like, अगर लोग ऐसा भी करते, like they put the oil and they sleep thinking that next day the hair will grow more. So it's not fact. Yeah. Okay, that's interesting. So now, doctor, my
Yes.
favorite part. Can you give us some important tips for healthy hair?
Sorry, I missed your question, Mona. The tips on?
Healthy hair.
Yeah, so the various tips, how many tips? I'll give the top 5 or 7 tips. So, first is eat well. There is no
Mm-hmm.
substitute to eating well because your
Mm-hmm.
body is that machine which survives on what you give it, like what
Mm-hmm.
you basically feed it. So, eating well would be my first tip. It has to be a balanced diet. If you don't know what's a balanced diet, get your diet plan, take nutraceuticals, but always take on recommendation with the safety dosing and according to what your lifestyle is. So,
Mm-hmm.
first and
Mm-hmm.
foremost is good diet.
Mm-hmm.
Second comes for healthy hair is that, obviously you've not talked about the right shampoos, the right conditioners, because there's such fashion of sulfate free shampoo. If you have very oily scalp, very oily hair, sulfate free shampoos don't go for you. So it's not that we just blindly. Second thing I would say is just not blindly follow the trends because each person can be unique. You might have curly hairs, the other person has oily hairs. You never go to gym, they go to gym daily. You don't
Mm-hmm.
swim, they swim. You don't put the hair styling gels, they put. You don't color your hairs, they color. So there's so many differences, and therefore customization of your hair care routines, your shampoos, your conditioners should also
Mm-hmm.
be customized, and blindly the trends should not be followed. Third
Mm-hmm.
is, yes, hair oiling can help a bit. Don't put on the scalp skin, use it on the shaft so that the hairs are shiny, glossy, they are not that tangled, so they are manageable. So the
Mm-hmm.
right combing habits from below to up. So these are the various grooming habits. Little trimming every 6 to 8 weeks so that the ends are not damaged and they get in the pace of growing. So the
Mm-hmm.
right grooming habits would be my third. Then fourth would
Mm-hmm.
be, you know, depending on what type of fall you have for healthy hairs, if you think they're not behaving well or they're not in the healthy phase, you must consult a dermatologist who is your right trichologist. A
Mm-hmm.
dermatologist takes care of skin, hair, nail, and your aesthetic concerns. Many times patients don't know that. So you always visit your specialized person to help you with the right things for your hair. So
Mm-hmm.
don't delay too much if you really want results. Don't wait for
Mm-hmm.
6 months and the hairs are falling. The less the stage, the less severe the
Mm-hmm.
case of even hair fall, the better the
Mm-hmm.
results. The more the hairs are fallen, for example, men hair loss, we see everything is bald, and then they think, what can I do without the surgery? What supplements should I take? So many times it's
Mm-hmm.
not easy to, give results when the hair loss has progressed. So for healthy
Mm-hmm.
hairs, fourth tip would be intervene timely and
Mm-hmm.
intervene, get the help of a specialist, and that's it. And just basically take care of your stress levels also, because in the healthy, as we say, in the healthy body stays the healthy mind, the vice versa is also true. When your mind is healthy, you physically also behave much better. You work hard for yourself and take care of yourself in various ways. So that also, as I was saying, hair is sensitive to everything, so that also has an impact on how your hair will behave, how they'll grow, how they will fall less and stuff like that. So those will be my tips for healthy hairs.
Yeah, it was quite like a good motivational tips, and I think our viewers would have followed it, and even I'm gonna follow all of it. And this discussion was very informative, doctor. So there are like many live audience questions. Can I take one or two for?
Yeah, yeah, absolutely, Mona. Please go ahead.
Yeah, so the first क्वेश्चन फ्रॉम माय व्यूअर इज, हाय डॉक्टर, मैं छतरपुर से हूँ, मुझे आपका अपॉइंटमेंट चाहिए और मुझे एंड्रोजेनिक एलोपेशिया सी ग्रेड है, बाल वापस नहीं आ रहे हैं, कुछ सोल्यूशन है मेरे लिए?
So yes, definitely we are also in Chhatarpur. You can just visit either our website or you can just type Skination Clinic Chhatarpur. You'll get onto our Google page. You are most welcome to contact us, and we'll see what best we can do for you because examination is important. I honestly I don't understand when you say androgenetic alopecia grade C because they are grade 1, 2, 3, 4, 5, 6, 7. So you have to be, it has to be something different. But yes, we'll definitely help you in the best possible way.
Okay, okay. So people who have androgenic alopecia, they can also like have the hair back. It's nothing like they have to
Yeah,
stay
see,
like.
they might need combination modalities. There might not be one best solution. There might be combination modalities that we have to uptake for the best results. That depends on the staging of the patient, the age of the patient, honestly, the motivation of the patient. Many times they want results in 15 days, so that might not be possible. It takes
Okay.
time and patience and everything put together. So here's also test your hard work. So
Yeah, yeah,
yeah,
yeah.
that's how it
So
works.
everything is like a quiet journey kind of a stuff where we need to stay positive and
Yes.
keep going. Okay.
Yes.
Another question from our viewer is, hi doctor, my daughter is 12 years old and she has lot of white hair at such young age. We did everything, putting turmeric oil, everything, but no hair is black until now. Is there any solution for my child?
Yeah, so many patients come for this. This is called as scanitis. In
Mm-hmm.
simple language, we call it premature graying of hairs. So since the
Mm-hmm.
daughter is only 12 years, most of the time, if it is before the age of 25 years, we consider it as premature graying, like it's getting gray
Mm-hmm.
at an early age.
Mm-hmm.
So first we have to know the causes. Many a times it's the genetic cause, familial, family, parents or grandparents also had graying of hairs at an early age. Honestly, there's nothing much we can do about it if that's the case.
Mm-hmm.
Otherwise, the second cause can be hypothyroidism. So if you have not tested the daughter for hypothyroidism, especially if there is a family history,
Mm-hmm.
and because there is scanitis or premature graying, the thyroid profile should be done. Also, check for her nutritional status. For
Mm-hmm.
example, iron deficiency, folic acid deficiency, B12, vitamin D. But what you actually can supplement her is with the micronutrient called as calcium pentothenate, the
Okay.
deficiency of which is known to be a cause of basically graying of hairs. And
Mm-hmm.
to be honest, there is less of data saying that you if you supplement correctly and stuff like that. There's a solution called as melatonin solution, which has the constituent melatonin.
Mm-hmm.
There's less of data internationally to back the fact that back this that the hairs will again get the color. But
Mm-hmm.
yes, the experiences say, and with the patient's feedback, we know that many of times the progression, the speed at which the hairs are graying can actually be
Mm-hmm.
taken under control, which is also, I would say, not a bad deal because many times the progression is very fast and the parents are worried because the daughter is only 12 years old.
Mm-hmm.
So one of like calcium pentatonate supplements for hair loss is something you can use for at least delaying the progression.
Okay, okay. So the even young people can control, like who are below 25 or 20, they can control the white hairs with the help of a doctor instead of
Yeah,
applying
it's
the
actually like
cancer.
it is known
Mm.
to work better in that age frame. It's not that
Yeah.
people about 25 can't use, but it's
Hmm.
that the results are more promising when the patient is younger.
And like they said that they are applying turmeric oil and all, it won't help. It's better the
There's not
physically.
much data to back that up. There's not much data scientifically to support the fact
Mm-hmm.
that to support this. We don't know even if it's a fact or not. That although phytoceuticals have their own role. For
Mm-hmm.
example, there are caffeine shampoos. So there now there are small scale studies suggesting that caffeine can decrease hair fall or stuff like that. But then also its role in canitis is not well known. Like early graying, the role is not well known. But then I'm not sure about turmeric. I don't think with scientific data that it works well.
Mm-hmm. I quickly take the last question from our audience because we are running out of time, and even I want to know this question. Hi, doctor. How your skin is so glowing? What is your skin regimen? And also, can you give tips for having keratin treatment or on hair or not?
Okay, thank you so much for the compliment if you think my skin is glowing. But yes, see, I totally believe that glow comes from within also. Although I'll give
Mhm.
you tips for skin glowing, otherwise with the topicals and everything. But what I really believe is that you should enjoy whatever you do in life, and then you get the that inner glow also. So I'm loving my job also. I'm a full-time dermatologist and a mother of 2 years old.
Wow.
So I'm loving both the roles. So that's one thing that gives you a glow. If you can see that,
Mhm.
thank you so much. I'm happy that you could notice it.
Mhm.
Otherwise, for healthy skin, otherwise, see, it depends on what skin type you have. What is it that, uh, for example, if you have dry skin or oily or combination or sensitive, you would need skincare according to that. Your face
Mhm.
wash should be correct. Then, because you wash, you have to hydrate it. Then, you should use a sunscreen to protect your skin. Then
Mhm.
comes various things. For example, if you put a hyaluronic acid based moisturizer that gives a plumpy shine. If
Mhm.
you are not very sensitive or oily skin patient, you can use vitamin C for a glowing skin.
Mhm.
Then, it has to be customized. For otherwise glow, you can take good supplements. Like we were talking about nutraceuticals for hair. For skin also, you can take nutraceuticals.
Mhm.
Then basically these are the key and the basic steps of
Mhm.
glowing skin. Otherwise, yeah, she asked about keratin treatment also. No, I would not say it is recommended by a dermatologist or a hair specialist,
Mhm.
because definitely they break the disulfide bond. How does the hair get straight? Because the bonds, the disulfide bonds that were
Mhm.
keeping the hair together and were also the reason of hair strength are broken, and therefore the hair gets straight. So
Mhm.
obviously there's a lot of damage happening to the strength of the hair. The hairs
Mhm.
can become more breakable, they can become weaker, and the
Mhm.
strength of the hair, you can experience a fall also. But
Mhm.
as it is said, we all do stuff that makes us happy. So if you want to do that so that you feel
Mhm.
happier, you can
Mhm.
definitely try it out. But I would recommend you should not do it when the hairs are already falling or when you are in a bad hair fall phase. You should at least take some supplements, take some medications, consult a dermatologist. When hairs are
Yeah.
healthy, when you have done those, then you can take those treatments, which is a better time to take that.
Mhm.
Won't be a recommendation from my side, but if you really want to go ahead with that, then at
Mhm.
least there can be better choice of time to do that.
Mhm.
When the hairs
Mhm.
are healthier and you have done taken care of that, then
Mhm.
maybe you can go ahead with that.
Okay, interesting. So females who wants to go for any hair kind treatment or chemical treatment, they should go to the doctor pre and post so that they can protect also and they can stay happy also.
Absolutely, absolutely.
Okay, doctor. So finally, doctor, would you like to give any take home message to our viewers today?
So I would just say, because the hair session, we all enjoy healthy long hairs and shiny hairs and stuff like that, and it's not unachievable. Many times I see very depressed patients feeling very low about themselves, as you were mentioning, Dr. Mona, that losing the confidence. So there are ways out. We can definitely, as hair specialists, can help you reach the best possible outcome. But be patient whenever you consult a dermatologist for your hair concerns. Give it time, discuss everything, follow things. If the things are not working out, then again, you should revisit. You should give a time of at least 6 to 8 months before you judge that the results are coming or not coming. Because it's a
Mhm.
journey, it's not an immediate outcome.
Mhm.
So this would be my take home, because those I see 90% patients who say that the treatment didn't work for them are the patients who didn't continue even for first 3 months, which is
Mhm.
just the beginning of the journey of the better journey towards better hairs or decreased hair fall. So be
Mhm.
patient, be regular, give yourself your some time, give hair some time, give your doctor some time, and
Mhm.
things definitely work out.
Yeah. So early intervention is the key. The more early
Yes.
and less frustrated
More
you would be,
patient.
and yeah,
Yes.
more patient. Yeah. So, doctor, I love talking to you, and I think I can go on for like more. But yes,
Same here, Mona.
standing.
You are a lovely host. Same
Yeah.
here.
Thank you, doctor. So, but now the time doesn't allow us. But yes, thank you so much, doctor, for sharing all your expertise with us today and answering all the questions of our viewers today. I'm sure the viewers have found the session very helpful. And thank you, doctor. It was delight to have you, and thank you so much for your time.
Thank you so much. It was all my pleasure. Thanks to IPCA team. Thank you so much.
And also, thank you so much to the viewers for joining us today. And yes, next, I could not take all the questions, but yes, if our doctor have some time, anytime, whenever she will be having some time, we can take her appointment and discuss and create more awareness on this platform for hair and skincare. And until then, see you soon, doctor, and take care.
Yeah. Thank you so much. Thank you to your viewers too. Thank you.
Bye bye. Take care.